Good afternoon and welcome to this webinar organised by the Public Health Network Cymru. I'm Andrew Parr and I'll be your moderator for this session. Before we get started, can I just advise you that your cameras and microphones are disabled to allow all focus to be on our speakers. But we are interactive. You can let us know your thoughts by typing comments and questions for the speakers into the Q&A box, which is going to be open throughout the whole session. Questions for speakers can be put live to them at the end of their presentation by Christian, who's our facilitator for today, and you'll meet in just a moment. So stick around to the end if you'd like to hear your questions answered. The question and answer box, just for those who don't know, is accessed by clicking on the icon which shows two caption boxes with a question mark, which for most people is on the top right of your screen. It's worth keeping an eye on the Q&A box, as myself and my colleague Angela, who's providing technical support, will post messages and useful links in the box throughout. I should advise you that this event is being recorded and will be available next week on the Public Health Network website. And if you head there at the end of this, you can also sign up as a member of the network and be amongst the first to have sight of upcoming events and to receive a copy of the monthly e-bulletin. Being a member will also allow you to influence and contribute to the events and publications. Captions are available by clicking on the CC icon on your screen, and we do have captioning available in Welsh language as well as English. Although do be advised that this service is automatic, it's not provided by Public Health Wales and accuracy is sometimes less than perfect. And please note that we do rely on technology here and sometimes there can be hiccups and with connections and such. We're hopeful that we won't have any problems today, but if we do lose our connection, please bear with us while we try to reconnect. If you're experiencing difficulties with connection yourself, it's always worth disconnecting other devices which may be connected to the internet but not in use in your home or your office. And this is a new method of delivery for us, so your feedback is hugely valuable, and we'll share a link to a really short evaluation questionnaire towards the end of today's event, and we'd really appreciate you clicking on that and letting us know your thoughts. You can have copies of the slides emailed to you as a PDF if you request them through the Public Health Network Cymru's email address. And finally, if you require a certificate of attendance for this event, please drop your name and email address into the Q&A at the end, and this will be kept private from other attendees. Okay, so without any further delay, I'll hand you over to your facilitator for today, Christian Heathcote-Elliott.
Good afternoon and welcome to the second webinar hosted by Public Health Network Cymru. My name is Christian Heathcote-Elliott and I am the new Principal Public Health Practitioner for the Wider Determinants of Health Unit in Public Health Wales and Manager for the network. In the network's first webinar last week, Dr. Chris Williams gave an excellent overview on the epidemiology of COVID-19 and his thoughts on developing a vaccine. This week, I am absolutely delighted to welcome Liz Green and Laura Morgan. Liz is the Programme Director for the Health Impact Assessment at Public Health Wales and the Director of the Wales Health Impact Assessment Support Unit. She is also Visiting Professor at the World Health Organisation's Collaborating Centre for Healthy Urban Environments at the University of West of England. Laura is a public health researcher for the policy team at Public Health Wales. Both Liz and Laura have extensive knowledge, understanding and practical application of health impact assessment and health integration. So we're really pleased that they're here to share their findings for the work that they've done on the health impact assessment on staying at home and social distancing policy in Wales. A policy which has touched all of our lives since March and which has been the subject of much discussion and media attention. I'd now like to hand over to Dr. Chris Jones, who is the Chair of the Health Education Institute for Wales. Chris is a GP by background with over 30 years experience and has a strong interest and passion in population health, health inequalities and working with communities to improve health and well-being. So Chris will say a few words by way of introduction, and we're really pleased he's here as well, to our topic today before we hand over to Liz and Laura.
Prynawn da pawb a croeso gynnes iawn. A very warm welcome to you. Rwy'n ddiolchgar bod yma efo ti heddiw a rwy'n edrych ymlaen I gweld beth mae pobl yn meddwl. I'm looking forward to what you think. Mae bywyd pobl yn Cymru yn bwysig iawn. The population of Wales is individuals and their lives they lead is really important. Mae pobl yn pwysig a mae'r iechyd yn pwysig. Individuals are important and their health is important. Mae'n diddorol iawn I gwybod beth sydd wedi digwydd. It's really important to know and understand what has happened in these extraordinary times. Ond mae mwy pwysig, mae'n pwysig mawr I ddysgu am y dyfodol. It's even more important to learn for the future. So today, with this publication, this health impact assessment, staying home and social distancing, we can reflect on what has been extraordinary. Now, I thought I'd seen most things as a GP. They reckon if you've been a GP for 10 years, you've seen it all. Think again. I don't think that many people will have experienced situations like we've all gone through, but we have gone through it together. And I think that when you think about the lockdown, when you think about what social distancing has meant for you as an individual, for the people in your communities, and for the people you might be caring for your workplace, and for the shops, the industries around you, just think about, we were told to keep safe. And that's an interesting question. Keep safe in terms of keeping safe from COVID. And we have to reflect on, there's been some really bad outcomes for people. It's been sad. There have been people who have recovered, but all of us were told to keep safe. And the impacts are really interesting. Some of them have been positive, some of them have been negative. And I would say to you that social distancing is counterintuitive to the human condition. The cuddle, the touch of the hand, being able to see a smile. Imagine not having seen anybody and your only contact has been the television or the radio. The news, the repeated impulse of questioning decisions, the press, the media, the politicking that happens, all of it has different effects when we've been living in isolation. The report that Liz and Laura have put together, and I think we should all recognise this was done real time. That really is an important thing. It's very easy to look back and put a flavour, but actually when you're writing it contemporaneously with the situation, that is a real opportunity. I think they should be really congratulated. The report is challenging. It feels real, but there's also hope in there. The opportunity to learn and keep the positives. The opportunity to reflect and to actually consider what could have been done better, what we could do better going forward, because whilst we talk about this as if it's over the last few months, we have to face up to the fact that some of this is going to be with us for some considerable time. And it may get uneven. Some places may have to go into social distancing in much more severe ways and back down into lockdown. So there's a real importance here. We must always remember the vulnerable and the isolated, the have-nots, those who have not got the same opportunities as many of us. We should also consider what are the impacts been on relationships and what it's been like for our young people and what it's been like for some of our very, very vulnerable elderly who've been in a very difficult space for them. So, considering our physical health and our mental health, the report is really challenging. Just one last thought from me. Those of us that have been working in the front line, and those of us that have been working to support the front line, we also have our own lives to lead in our own communities and within our own families. And I think the dynamic of social distancing has been quite difficult for some of us who are working as well as actually living our lives with our families. So without further ado, I'm going to hand us over now to Liz and Laura. I congratulate them on doing this piece of work. I thank them, and I hope you all enjoy the rest of this webinar. Don't forget to use the Q&A box, and your questions will be answered at the end of the session. Hwyl nawr a diolch yn fawr.
Thanks very much, Chris. So I'm Liz Green, and I'm going to, with Laura Morgan, share with you some of the insights that we found and an overview of the health impact assessment which we carried out in a very short time frame, as Chris said, at the start of what is now known as lockdown, or is informally known as lockdown, but is more formally known as the staying at home and social distancing policy in Wales. We're going to tell you a little bit about how it's affected people's lives and who it has had an impact on, and some of what we can learn for the future, and that there are ways that maybe we can maximise some positives that we have found, and what we can think about for mitigating any future negative or unintended consequences for policies when they're implemented. Before I go on, I would just like to say that this report was a collaboration between a number of people in the WHO Collaborating Centre for Investment on Health and Wellbeing, Public Health Wales. And I'd like to thank all the team and all those who also contributed via interviews or feedback on the reports. And everything was very valuable, and we used it, and we couldn't have done it without them. So now I'm going to hand over to Laura, and she's going to take you through the first few slides.
Thank you, Liz. Hi, I'm Laura Morgan. I'm going to just set out for you the aims and approach of the Staying at Home and Social Distancing Policy, HIA. Can I have the first slide, please, Liz? I will carry on regardless. So the aims and approach. The purpose of the Staying at Home and Social Distancing Policy, HIA, was to better understand the impact of the policy in Wales, and in particular who it affects and how it has affected the various populations of Wales. It supports Pillar 3 of the Welsh Government's Leading Wales Out of a Coronavirus Pandemic, and it can be used to support recovery and inform future actions. As Liz said, it was carried out earlier on this year in real time during April and May, and its scope is comprehensive and participatory. The HIA has aimed to assess the positive outcomes of the policy, the opportunities arising from it, as well as the negative and the unintended negative impacts. As with any HIA, it's been evidence-based, and we've used the wider determinants of health and well-being as a lens to consider the inequalities between the different population groups in Wales. Now, I appreciate that not everybody listening to this webinar this afternoon will have come across the term HIA or health impact assessment, but the process is fairly straightforward. The first step is a screening process, followed by scoping, appraisal, reporting, and a review and reflection. So it's a 5-step process. It's systematic, yet it's flexible, so it can be scaled up to be comprehensive, as in this case, or scaled down to be a rapid assessment, depending on the amount of evidence to be captured and appraised. In reality, it's an iterative process, and practitioners can move back and forwards through each of the 5 stages as they identify evidence, or if there's none found, determinants can be scoped in and out. We used 4 different types of evidence for the HIA. We did a literature review, stakeholder interviews, put together a population health profile, and in this case we had access to Public Health Wales Public Engagement Survey on health and well-being. Our literature review used a wide range of evidence, including World Health Organization publications, previous Public Health Wales work, such as our Brexit HIA, research we've done previously into mass unemployment, as well as peer review articles, grey literature surveys, and media articles. In this case, we found very little evidence in relation to quarantine and isolation for pandemics around many of the determinants. For example, healthy behaviours such as diet and nutrition or physical activity, there was very little evidence that we could find. I'll come on to stakeholder interviews in the next slide. But we also put together a population health profile using health and well-being stats from across Wales and mapping that onto the different populations across Wales. And I've mentioned our public engagement survey. This was a survey that was set up by Public Health Wales at the start of the pandemic, at the start of lockdown. And it's a Wales-wide real-time survey, it's a tracking survey, and we've been able to monitor and track the health and well-being of people across Wales during the pandemic. For this particular HIA, I carried out the majority of interviews. We carried out 13 interviews with, I think, 9 different organisations, and we received 4 submissions from stakeholders. Although we spoke to a number of colleagues in Public Health Wales, but also organisations across the public and third sector, including NGOs and umbrella organisations such as the WLGA and the WCVA. It was heartening to see that most had rapidly developed specific plans or amended existing plans to adapt their services both for the immediate short term, and many organisations are also looking forward making plans for the next phase of the pandemic. And most had moved rapidly from face-to-face to online advice and developed support services or interventions either independently or quite often in partnership with others. Key issues that we found arising from the interviews were issues around mental health and well-being, and this applied across all population groups to a greater or lesser extent. We also identified issues around safety nets for more vulnerable populations, but again, it's good to see that there was some good practice around support for children and young people in particular. Key concerns arising from interviews were below the radar groups. Some of these were known and others were unknown, but one particular example would be people whose income was reduced as a result of lockdown, but who for various reasons didn't qualify for the job retention scheme. And obviously other populations of concern were people with pre-existing conditions. So who did we identify? Those at most risk of mortality and morbidity from COVID-19, there were 5 key groups. Do you want to move forward one slide, please? Can we move forward? Yay. Okay, so there were 5 key groups most at risk of mortality and morbidity. The first of these was older people and those in closed settings, for example, older people in care homes. And we found that older people are 5 times more likely to die of COVID-19 than other groups. And as the pandemic and as lockdown progressed, it became clear that Black and minority ethnic groups, BAME groups, were being disproportionately affected by COVID and by the lockdown. And over a third of those in critical beds we found were from BAME backgrounds. The third group is men. All-cause mortality was 4 times higher for Black males, 3 times higher for Asian males, and twice that of white males when compared to statistics from 2019. The fourth group, again, was the population, people with pre-existing conditions, particularly those with respiratory conditions, obesity, and conditions such as diabetes. And lastly, we found that people who lived in areas of most deprivation were twice as likely to die from COVID as people in more affluent areas of Wales. Can I have the next slide, please? Great. Okay. But the policy is a protective measure for all of us. So as well as the population groups that I've just spoken about, other groups that were majorly affected were children and young people, for example. We found that lockdown and COVID had a big impact on their future prospects and potential educational attainment. Those on low incomes, obviously the economic impact of being furloughed or income being reduced, and that was compounded by being at home, and for some that meant higher bills. Other groups, we found a large disparity between rural and urban areas in Wales, particularly in an ability to access services, connect to broadband, connect with the internet, and to participate in active travel in place of public transport, for example. And women also suffered a major negative impact. That was for a number of reasons. We found that women were more likely to pick up the majority of caring responsibilities. That is for babies, for older relatives perhaps, but also they picked up the majority of homeschooling responsibilities. You'll no doubt be aware of the increased incidences of domestic abuse, and women are also most likely to work in sectors that have closed down over the last 3 or 4 months, such as hospitality and the retail sector. That's the end of my part of the presentation, so I'll hand over once more to Liz.
Thank you so much, Laura. Apologies for the technical difficulties. My broadband seems to have gone a bit crazy. Okay, so hopefully you can all see this. And I'm now going to talk about the areas of impact and the policy areas of impact that we identified as part of the health impact assessment. So first of all, I'm going to talk about the impact on health and social care. And actually, the text in red is the negative impacts or the unintended negative impacts we identified. And the green is the potential opportunities, or what we found is positive from the staying at home policy and the lockdown. So in terms of any negative impacts or unintended negative impacts, there was reduced capacity within the health and social care services and their delivery, and some routine operations and appointments were cancelled. And also we identified that many individuals were not actually accessing services within healthcare because of fear of exposure to the virus and of catching the virus itself. However, we did also find that one of the key positive things was that services quickly adapted, and there is a magnitude of resilience within the delivery of services, and that actually new methods of working were quickly brought online. So, for example, telehealth or GP consultations by phone or video or even text methods meant that everybody who could access or wanted to access support and healthcare could in some way, shape or form. And this has meant that actually, could we use this as a platform, this accelerated transformation in some ways, the methods of working, for future models of service delivery in the future, and look at what's happened now and how we could build on maybe some of that strength and that resilience to future-proof some of our services. In terms of the actual people who've been affected, health, social care frontline workers, reports of increased stress, higher risk of exposures, less to stress and anxiety, and an increased risk to mental well-being. And some of the evidence papers, the literature review that we did, identified in previous pandemics and outbreak that there had been an increased risk to mental well-being for frontline workers. And also, one of the positive things was that actually we've seen increased recognition of what critical workers, including health and social care and carers, what they do, and the essential nature and importance of the role and the jobs that everybody does. In terms of mental well-being, a wide range of negative impacts there, as you can see, and that's both through the stress and uncertainty of lockdown and the staying at home policy and how long people would be in this state. We still don't know what's happening, how long, the timeframes that we will have coronavirus with, but also that fear of the virus, fear of exposure, fear of catching it, and all the consequences that come with that. There's also stress in terms of social disconnection, increased isolation and loneliness, particularly if you're somebody who lives on their own or you're an older or vulnerable person, and those economic implications of, for example, job insecurity. Many people have been furloughed. Not many people are sure, even now, of what's going to happen if they return to work, what their sector will be like, what will happen for the future. And there was we identified increased impact in terms of children and young people and their mental well-being through not being able to go to school or education, and having that disconnect and those routines and not knowing what was really going on in terms of that wider landscape. And then for those with existing poor mental health, there's been reduced access to services and treatment, again uncertainty about the future, and that heightened fear of exposure for some groups. But also, again, we've seen resilience, and that there is an opportunity to provide enhanced services and to make sure that those who need it most still get access and still can have those services in some shape or form. And that again gives us an idea of what we can think about for the future. In terms of business and the economy as a policy area, then again, economic inactivity and activity has had a massive impact, and we are still seeing that now. This was carried out in real time, and obviously most essential services, shops had been shut. Some sectors were shut down: leisure, hospitality, like Laura said, retail. Supermarkets and essential businesses remained open, and actually they saw an increase in expansion and more demand, and that they needed more people, more delivery drivers, more people to restock and replenish. But for others, then it has had a significant impact. And as part of our Brexit health impact assessment work, which Laura and I previously worked on, we identified a number of potential negative impacts for the economy as part of Brexit, and we're sort of seeing the same synergies with this. And so, for example, the risk to towns that are areas that have a single employer, such as Airbus in North Wales, for example, and what can happen there. But also in terms of who is affected by this economic inactivity, then most people who are in those sort of sectors that have shut down tend to be women and young people, and about a third of under 25s in Wales work in a sector that has been closed down, such as hospitality or retail, and for them they're essential streams of income in order to protect their future, or while they're working through education, for example, or it gives real life work experience. And so it can have an impact, not just now, but on longer term future for a number of young people, young adults, for example. And then in terms of home working, many of us have got used to home working and the challenges that that brings, such as slide sets not being presented, or us having difficulties with our being on stream or our broadband, or just dealing with different challenges, such as how are we digitally literate, what if we have other responsibilities. Much of the homeschooling, for example, has fallen on women as parents, and many are also trying to deal with other responsibilities at home, caring responsibilities, and working from home as well. But we've all continued to work in some shape or form. We can work flexibly, we can provide our services, we can continue, but also we had we identified that there were impacts in some of the research papers and the literature papers that in previous studies that you can actually have an enhanced work-life balance, and that's, for example, through not having to commute or having a long commute and all the challenges that that brings and takes time out of a day. So people were saying that actually they could spend more time with their family, they could exercise, because under the stay-at-home policy in Wales, people were allowed out at the time period we were doing this once a day to take physical activity. And so it was providing other opportunities for people and could be protective for their health and well-being in that way. And then for key workers, again, stress, anxiety of being on the front line, of having a higher risk of exposure to patients and the public, but also that increased appreciation of what was being delivered, but also making people think of, well, what is a key worker? There was a very clear focus on the NHS, social care services, but also we must recognise that the police, other public services, local authorities, and people such as delivery drivers and supermarket workers were providing some of the fabric and foundations for us to all remain safe at home. And so, you know, we've seen an increased appreciation of key workers and the roles that they provide in a range of ways. So in terms of who was affected and inequalities and equality impacts, Laura referred to violence against women, domestic abuse and sexual violence, and women are mostly affected by this, and there were increased calls to helplines such as Refuge and Women's Aid, but it also affected men as well, and there was an increase in inquiries and reports to helplines for men as well, and also the need to remain at home increased the risk of harm under lockdown for some women, some families, as it could be said that and evidence suggested that some people, some women, actually when they go to work, it can get them out of an abusive environment, and the same for children with adverse childhood experiences, that they are locked up at home with their perpetrator or abuser, and there is very little escape. So the impact was mainly felt on children, young people and women in terms of this area, and for women particularly, there was an impact across all age groups. So the age ranges from children, young people, through to older women, where, for example, they were they've been cared for, or maybe carers, and have caring responsibilities. Women are more likely to work in the sectors closed down, as we said, like leisure, services, hospitality and retail, but also they're more likely to work in frontline key services. So 47% of all the women in Wales work in 3 major areas, and they're all frontline key services. So that's the NHS and social care, so that's retail and, for example, supermarkets, which we've referred to, but also education and childcare. So that's a very large proportion that actually work in these key frontline services. And like I referred to, women are more likely to have caring responsibilities, including homeschooling and looking after children, running a house, working from home, but also looking after extended family members too, and elderly parents in some cases. So there were also those on low incomes were affected, and those who have reduced income streams, those who were furloughed and receiving 80% of their pay, and actually remaining at home could lead to increases in food and fuel poverty. So, I mean, the time that we looked at, actually the weather was very hot, was very warm, and people's experiences may have been very different if it was during winter and you needed to have the heating on, and also increased numbers of family members to feed under those conditions as well. You might need more energy use as well. And so that, as a proportion of your income, then could lead to that risk of struggling to also pay mortgages and pay your bills as much as food and fuel poverty. In terms of Black, Asian and minority ethnic groups, increased risk of mortality and morbidity, as Laura said, from COVID-19 itself, but also for some groups in the population, English may not be first language, and so therefore they needed extra support or need extra support. And some of our colleagues in Public Health Wales, in the ACES support hub and the violence prevention unit, actively worked to have a lot of information translated for a wide range of groups in Wales. so that you know, the implications of COVID and hygiene and hand hygiene, as much as the regulations, were also considered. But also we must consider that it, as a positive for the policy, it protected the whole population, and particularly those who are more vulnerable and at higher risk. So older people, those with pre-existing conditions, for example. And it's actually gave us an opportunity to think about, well, the future recovery and the phases of how we move out of lockdown, how we progress in the future to improve health equity and improve our policies to consider the implications for everyone within the population. So in terms of communities and the impacts on the community, we saw a massive increase in volunteering. So a Public Health Wales Public Health Engagement Survey, in the first 3, 4, 5 weeks, every week, at least almost a third, 27% in week 3, were reporting that they were volunteering actively in their community, and many were also stating that they were helping neighbours, they were helping extended family, they were checking in on them. And there's been this huge mobilisation between neighbours and in communities, and social mobilisation, both in person when possible, but also online and digitally too. And in terms of the organisations, though, whilst it's been fantastic that so many people have wanted to volunteer and wanted to support their communities, then it's been challenging by the numbers of people, but also, you know, it's brought with it challenges around, well, future funding streams. So, for example, many charities and those in the third sector rely on retail outlets and retail sales in order to support their work, and some of those were closed, obviously, as being classed as non-essential, and therefore the income streams have significantly reduced. And also for some of their vulnerable clients and actual workforce, remote working does bring challenges, and many people like face-to-face contact. And also working digitally is great, but many people are not techno-savvy, and trying to get to grips with different platforms has been challenging for many people. And then, like I say, there's been visible social capital and support for others. And there's a real opportunity to help harness this momentum for the future. So how can we capture it? How can we use it as a platform for going forward? And then for communities, people have had very different experiences, whether you're an urban community or you live in a small hamlet or a village, whether you've got access to green space or not, what type of internet access you've got, and you know, the speed and the working of that. In terms of a negative impact, there's been loss of income from tourism, and we're seeing people being encouraged to have staycations only in the last sort of 24, 48 hours in Wales, to help sort of increase people's income streams and try to get the economy back on its feet in Wales, but also, you know, for people to gain an appreciation of actually the country that we live in, and re-enjoy some of what Wales has to offer. In terms of older people and populations, there have been a range of negative impacts: isolation and loneliness, both physical and social loneliness, because many older people do live on their own. that the mental health and well-being impacts, but also the challenges around digital connections and being disconnected and isolated from social, familial and community support networks. And in a Public Health Wales report from 2019 looking at digital access and digital exclusion, literacy, digital literacy is a big thing. And in Wales, 1 in 10 homes still do not have access to a laptop or a tablet. And people are not just health literate in some ways, but digital literate, and don't own a smartphone either. And that's particularly true amongst older people in Wales. But also care and support services have still remained in place for older people where appropriate. And like I said, people have found, organisations and services have found different ways of delivering that care and that support and connecting with people and trying to remain connected. In terms of education, as I was saying about digital exclusion, for children and young people and young adults as well, many of their education has been curtailed, school closures, except for those with who are key workers, children of key workers, and that has been a positive thing, but a closure of a wide range of settings. And that has had an impact in a range of ways. So for some children and young people who maybe are on the autistic spectrum, you know, that loss of routine had a major impact, but also on social development and socialization of children and young people, and connecting with their friends and socializing with them, but also you know, working to and alongside adults as well, in terms of the way that everyone behaves and their behaviour, and learning from each other and that development. But this can also have a longer term implication, not just short term, but longer term on educational attainment and economic prospects for many children and young people in Wales. And the variance in homeschooling experiences. So in terms of internet connection and broadband access, we identified that up to 700,000 children and young people in school do not have a tablet or a laptop or access one in order to carry out their studies. And a further 600,000 felt that they couldn't carry out some of their education or work without that kind of access and that internet access. So the variable nature of internet access and access to laptops and toys and parental support has made some experiences for some children and young adults very different, and it could be positive and it could be negative in that respect. And the same for living in a home environment and their relationships with their family and those close relationships. And again, you know, so some children may have increased exposure to ACEs and that impact on mental well-being as well as physical risk, but also others may have suddenly reconnected with their families and spent more time with them, enjoying the open air, etc., etc. I'll try to move on quickly now. So in terms of housing, we all live in different types of housing, and our experiences will be dependent on that in lots of respects. It could be positive if you live in a house with plenty of space, you've got your own space for an office, or you can turn for example, spare bedroom into an office, or it could be negative, dependent on if you live in a home of multiple occupation or a shared home, or whether you have a garden or not, how far you live from accessible green space or not. So it can be very, very different, and I'm sure we're all familiar with that amongst our own social circles and networks. For those who live on low incomes, like I said, housing experience can be very different because you could spend a higher proportion of your income on food and fuel and energy. But for those who may be in abusive relationships, then it's very, very difficult if you're in a small confined space. And those with poor mental health, and that being enclosed may have ramifications there in a negative way, in a much more negative way than for those who maybe are a bit more resilient. So the whole population was affected in terms of housing and access to services. But for those who are homeless, particularly, it had a positive impact in terms of it led to an end to street homelessness. All local authorities in Wales were required to provide accommodation, and the streets were in effect cleared, and somewhere to stay was provided for all those who needed it. But also there is hidden homelessness in terms of sofa surfing, and what happens there was harder to unpick. And so we are actually going to carry out a future rapid health impact assessment in relation to housing and homelessness, and how the pandemic has had an impact, and what can we learn and what can we do for the future. But also, in terms of a positive, we do have an opportunity to look at our housing, look at the housing needs in Wales and what we can do for potential future emergencies. And so if we look at housing policy through the lens of pandemics, we can also look at it through climate change events and what can we do to future-proof our housing to account for unprecedented and unknown future events like this. And then in terms of environment and transport, reduced movement of vehicles and people because everybody was required to stay at home unless they were key workers. And we've seen reduced use of air travel and cars, although we are seeing now that the levels of car use is increasing again. Retention of essential public transport services, they continued, they adapted, they still run. And in terms of active travel as well, more people were encouraged to travel to their places of work if they're a key worker in an active and sustainable way. So you can cycle to work or walk to work if possible. There was reduced movement and vehicles has led to an improvement in the environment, improved air quality in some areas of Wales, and reduced levels of noise and pollution. So we've seen reduced levels of NO2, nitrogen dioxide, in some areas, but we've also seen in other areas of Wales increased levels of, for example, ozone. And I know that our colleagues in Public Health Wales Environmental Public Health Services team are looking at this actively. And so some of this impact, this positive gain, may just be temporary and transient. And in terms of delivery of environmental and sort of digital services, we have seen that digital literacy divide and that how it can lead to exclusion for some people, like I say, those on low incomes, older people, children, but also digital media and social media. Actually, whilst it can be a force for scams and fake news, for example, we identified as a negative impact, it can also be a force for good, and it was been a very an excellent way of quickly getting out information to people and promoting social connectiveness. So in terms of opportunities for the future, we can build on what a lot of the positives on social mobilisation, volunteerism. We can relook at sustainable models of working and the way that we work, live and interact, and also think about that environmental sustainability. We've also got opportunities to think about, well, what has this meant and who has it meant it for? We found that there were evidence gaps in the literature, which is unsurprising because it is actually an unprecedented event. And although we've had outbreaks and pandemics across the world before, something like this is very new. And so we'll need to further consider the impact on children and young people, for example, or older people in the environment. And so finally, next steps, we need to think about, well, have these impacts manifested themselves? Do we need to monitor it, see what we said? Has that come to fruition? And we are seeing now some reinforcing of what we said at the start of the lockdown and pandemic is being published, more evidence being published every day to reinforce this. And also I'm seeing that, you know, in order to inform any future localized lockdowns or implementing of strict regulations again around about stay-at-home policies, then this work could help inform that and ensure that any future waves consider the impact of policies such as this and the unintended consequences that it can have. We need to make sure that mental well-being, it's a cross-cutting theme across all of the determinants and for most of the population groups, that there is ongoing support, and also that we think about the long-term needs for children and young people, for future generations, and how we sustainably recover from the pandemic and some of the policies that are implemented. So that's the conclusion. We need to think about this all in the round. It's had a wide range of impacts across determinants of health and well-being, a wide range of groups affected. But we do have opportunities to build back better and think about what's happening now, along with other important policies such as Brexit and climate change. So that's just a final slide about what the unit does. I'd like to thank everybody who contributed to this work. They all did an amazing job, and those that collaborated and provided some feedback. We, as a unit, suspended all our activities, and so we actually did this also on top of our the acute response support work. So thank you very much.
Many thanks to Liz Laura for a really comprehensive presentation there, and apologies once again for some of the technical issues we experienced there, so apologies for that. Conscious now that we've only got a very short period of time for questions and answers. We've had quite a few questions through, so I think what we'll probably do is commit to answering some of those questions outside of this webinar. But just a general question really for Liz and Laura that's come up, which links to your second to last slide, which is very much about how you're going to monitor the impact over time, and whether you had any further thoughts about how you're going to do that. And I know quite a few questions have come up around the issue of both the positive and negative aspects around digital inclusion and digital exclusion, and how we look at that really over the future.
Do you want to go first, Laura, or shall I?
You go first.
Okay. In terms of monitoring the impact for the future, what we did was when we carried out the Brexit HIA, we continued to monitor that. So we set up a framework, some questions to look at not just the impact of did what we say, what we potentially think, has that come to fruition, which we don't know yet because of Brexit hasn't yet occurred, although we're in transit. But also which are the groups, what is the evidence we need to monitor, and we have carried on capturing that. And then we, over the 6-month period, for example, post the publication of the Brexit HIA, we captured all the evidence. So I think for this work, we will continue to do that, and we have continued to capture it even now since we had our cut-off date for the evidence to bring together for this assessment.
Thanks very much. And perhaps one, just really conscious, we've got about a minute left, just one question that came up was about how did you actually look at lifestyle behaviours as well in terms of the health impact assessment? So someone raised the issue about smoking. Did you look at those?
We did, and actually I talk about the research gaps and the evidence, and that is something that was very clear in the literature review and the papers, that there is no evidence out there about that. So when people have been in quarantine, for example, or isolation units, there was a lot of literature and evidence around mental well-being impacts, etc., but nothing about people's behaviours in terms of smoking, gambling, diet, physical activity at all. So there's a big research gap there.
Can I just add to that? I think the question referred to the survey, and if the survey that the questioner was referring to was the Public Health Wales engagement one, I do believe there is a question in there on smoking as well as alcohol, and I think there's some diet and food questions as well.
Yeah. So we found that some people in relation to the survey, some people were, for example, snacking more, like 35%, I think, in week 3 said that they were snacking more by being at home, for example. But in terms of things like physical activity, some people said they were taking less, some people said they were taking more, but the actual, when you leveled it out, it was only something like plus 3% difference between those who were and went. And the same smoking, I think there's no real difference.
No.
Yeah, I think there's some UK evidence which has looked at smoking as well and has found slight difference in different population groups. So yeah, once again, it has different effects on different population groups. Yeah, thank you for that. So I think what we'll do is we'll take some of the other questions and answers and answer them outside of this webinar. So once again, I'd really like to thank Liz and Laura for a really comprehensive presentation, and thank you to Chris for a very thought-provoking introduction. We will ask that if people could fill in the evaluation questionnaire, and there'll be a link on the last slide, and we'll also send you that link. And that if you're not a member of Public Health Network Cymru, we would really like you and welcome you to join. And we're going to take a short break over August in terms of our webinar series, but we will be bringing our next webinar in September. So we look forward to many of you to join us as possible. And Diolch yn fawr, thank you for joining us.
Well done, you lot.